Hi, my name is Ana Cláudia Pereira and I'm here to present the new concept for treating urinary and sexual symptoms in women with vulvovaginitis by using light-emitting diode, a clinical study phase 1. We are all from Bahiana School of Medicine and Public Health and the Center for Attention to the Pelvic Floor in Salvador, Bahia, Brazil. Hypothesis. Vulvovaginitis is an inflammation or infection on the vulva and vagina region. This common condition affects women of all ages. The urinary and sexual symptoms may vary from dyspareunia, leukorrhea, dysuria, among others, and have a negative impact on women's quality of life. In searching for no pharmacological treatments, it is brought to light the hypothesis that light-emitting diode might be a therapeutic option. Phototherapy emits light in different wavelengths and has been used in the treatment of pelvic dysfunctions. The wavelength variation causes a light color modification. Therefore, the effects of blue light may vary from antimicrobial, anti-inflammatory, and tissue regeneration purposes. This original study aims to describe clinical symptoms, sexual function, and quality of life responses in women diagnosed with vulvovaginitis, which were treated with blue lead. Materials and methods. This is a pilot study with 10 women from 18 to 45 years old with clinical diagnosis of vulvovaginitis. In a primary interview, the researchers collected all women's clinical and sociodemographic data and also their sexual history. Afterwards, the FSFI and Huckel breath questionnaires were applied to measure sexual function and quality of life. Women with a suspected diagnosis of vulvovaginitis underwent clinical examination of a gynecologist. Additionally, the examination of fresh vaginal sample, cervical vaginal cytology, pH measurement, and culture-specific tests for fungus exams were collected. Upon vulvovaginitis confirmation, the participants underwent the 405 nanometers blue lead application with power of 150 microvats per square centimeter and dose of 40.5 joules per square centimeter during 20 minutes. The figure 1 shows the LED device developed for this study, as well as the light spectrum and the radiation provided. The treatment consisted of 3 sessions with a 15-day interval between each one. All women were invited to return for a follow-up after 28 days. At this moment, they went through a clinical evaluation as well as the reapplication of FSFY and Huckel breath. 14 patients with clinical complaint of recurrent vaginal discharge associated with pruritus and diagnosed with vulvovaginitis were included in this study. Among these women, 3 were excluded for not adhering to the research protocol correctly. 1 participant was excluded because they had an intrauterine device. There was improvement in the following symptoms: pruritus in 6 and 8, leukorrhea 4 and 9, dysuria 7 and 8, and dyspareunia 8 and 9. Table 1 shows the description of sexual function and quality of life of all 10 participants. It was verified that after 28 days of 405 nanometer blue lead treatment, 7 out of 10 women had an increase in the general score on both questionnaires. The blue lead boosts the growth, metabolism, and differentiation of microorganisms such as fungi and yeasts. This occurs as a result of photoexcitation of oxygen-dependent intracellular porphyrin molecules, causing oxidative damage and microbial cell death. Specifically, in the genital region, these effects reduce clinical symptoms like vulvar erythema, pruritus, burning sensation, dysuria, dyspareunia, and edema without adverse effects. Multiple factors may interfere in the female sexual function, psycho-emotional and physical, like genital tract infections. The single-arm pilot study revealed a change in the sexual function score and quality of life after the use of blue light therapy in women with vulvovaginitis. This original research revealed that blue lead was beneficial for treating vulvovaginitis symptoms like pruritus, leukorrhea, dysuria, and dyspareunia, for improving sexual function and quality of life of women on a short-term follow-up. These results might suggest lead as a new therapeutic option for treating problems associated with vulvovaginitis. However, clinical trials with bigger samples and methodological accuracy are recommended. These are the reference, and thank you so much.